So our patients are going to be all stage 4 or metastatic non-small cell lung cancer patients, and all of these patients will have been treated with one of the new immune therapy or checkpoint blocker medications prior to being enrolled in our study. And so the patients that we will have in our study will be the ones that got some benefit from those medicines. Either they had a shrinkage of their tumor or they had at least stable disease for at least 3 months. And at the time when they begin to progress or their cancer recurs on these medicines, our study will enroll them to see if continuing this medicine in combination with the next line of therapy, which will typically be chemotherapy, is of benefit to them. These chemotherapy agents have been combined with immune therapies in a number of other settings, either the first line or sometimes in combinations in the first or second line. But this will be the first time that we see patients progressing and then we continue that immune therapy in combination with this. We want to make sure this is a well-tolerated regimen, especially in the second or third line setting for these patients. So most of us think of the immune system sort of as a way to fight off infection, right? But it also has a number of other responsibilities, one of which is to do surveillance and kill off abnormal cells, in particular cancer cells. And unfortunately, the cancer cells are very smart, and they oftentimes find ways to evade that immune system or get around that response. And one of those ways is by expressing a protein called programmed death ligand 1, or PDL1. And that protein interacts or binds to a protein on our T cells, which is one of our immune cells, and it sort of effectively tells that T cell to sort of go into a sleep mode or a quiescent mode where it no longer looks for cancer cells to kill. And that effectively allows the tumor to grow without being bothered by our immune system or detected by our immune system. Pembrolizumab, or the other checkpoint blockers that have come out, block that interaction between PD-1 and PD-L1. And the hope is that by blocking that interaction, we allow the immune system to sort of wake back up and resume its surveillance mode and to hopefully kill off the cancer cells that it detects in our bodies. And so this question is going to continue to be there because our patients unfortunately have metastatic disease and are often incurable, and thus all of them are going to have progression on these medications. And the question remains, should we continue these medicines at the time of progression, or is it best just to make a break and move on to the next therapy? We obviously don't want to expose our patients to the toxicity of medicines that are not beneficial to them. We also don't want to increase the cost of their care by continuing medicines that wouldn't work for them. But we wouldn't want to deprive them of a benefit that they might gain from continuing those medications if they were to be helpful.
This clinical trial is a phase 2 study evaluating the efficacy of chemotherapy plus pembrolizumab, which is also known as Keytruda, versus chemotherapy alone in patients with advanced non-small cell lung cancer who had experienced some benefit on treatment with an immune therapy drug, but then had some progression of their cancer. The usual treatment for non-small cell lung cancer that has returned is to give chemotherapy drugs by themselves or to combine them with Cyramza. Another option is to give drugs that block a particular enzyme. Keytruda is an immune therapy. It attempts to turn off a cancer cell's ability to hide from your body's own immune system. Keytruda allows the immune system to recognize and kill cancer cells. If you were previously on a drug like this and it helped your cancer, and then your cancer returned, you may be eligible for this study. Researchers will study if giving Keytruda with chemotherapy will help the body's immune system fight cancer more than chemotherapy alone after cancer that has once responded to immune therapy begins to get worse. This study will allow researchers to know whether adding Keytruda is better, the same, or worse than the usual approach. The use of Keytruda with chemotherapy when cancer has progressed after initially getting better while taking an immune therapy is investigational. This means Keytruda has not been approved by the U.S. Food and Drug Administration for use in this setting. Keytruda has been approved by the FDA to treat patients with non-small cell lung cancer after they have progressed on chemotherapy. This clinical trial will have one study group. All participants will receive Keytruda plus the chemotherapy drug of their doctor's choosing. There are other criteria that must be met to be eligible for this study. Talk to your doctor to learn more. A full description of this clinical trial is also available at www.clinicaltrials.gov.